Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a physiotherapist talking to a patient named Jake Daniels about his back pain. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at your notes.
Hi there, come on in. You must be Mr. Daniels?
Yeah, I'm Jake Daniels.
Okay, Jake. I understand you've been having some issues with back pain. Can you tell me a little more about what's been going on?
Yeah, it's been pretty rough, honestly. It started about a month ago, and at first I thought I just slept wrong, or maybe pulled something at the gym, but it's only gotten worse. Now, it's this constant dull ache, with sharp pain when I move certain ways. It's really affecting my day-to-day.
That sounds frustrating. Is it mostly in your lower back, or are you feeling it higher up as well?
Mostly lower back. The pain sort of radiates from there down into my hips sometimes. If I sit for too long, it feels like my whole lower back locks up.
And when you say it gets worse with certain movements, what kind of movements are triggering it? Bending over? Twisting?
Definitely bending over. I have to be really careful if I'm picking something up, even if it's something light. Twisting isn't as bad, but if I do it too fast, I feel that sharp pain, like a knife in my back. And lifting anything heavy? Forget about it.
It sounds like you might be dealing with some muscle strain, possibly affecting your core and lower back muscles. Did this start after any specific event, like heavy lifting or an accident, or did it come on gradually?
Well, I've been doing some weight training, and I might have overdone it on deadlifts a few weeks back. That's when I first noticed the pain, but I figured it would go away after a few days. Instead, it's just stuck around.
That makes sense, especially if you were pushing yourself during weight training. Sometimes overloading those muscles without proper recovery can lead to inflammation or strain, and if it's not addressed, the pain can linger. Have you noticed any numbness or tingling in your legs or feet?
Actually, yeah, it's not constant, but every now and then, I'll feel a bit of tingling in my left leg, especially if I've been standing for too long. It's not super painful, but it's there.
That's something we'll need to keep an eye on. Tingling or numbness can sometimes indicate nerve involvement, like a pinched nerve or possibly a herniated disc pressing on the nerves in your lower back. It could explain the pain radiating into your hips and the occasional tingling.
Oh man, I hope it's not a herniated disc. I've heard those can take a long time to heal.
It's possible, but let's not jump to conclusions yet. Many back issues, even involving discs, can improve with the right treatment, exercise and therapy. I'd like to start by assessing your range of motion and muscle strength, then we can work on a plan to relieve the pain and prevent it from coming back.
That sounds good. I'm ready to do whatever it takes at this point because this is getting in the way of everything. Work, sleep, even just going out with friends.
I understand. Back pain can be really disruptive, and the longer it goes untreated, the more it impacts your quality of life. What do you do for work? Does that involve a lot of sitting or physical activity?
I'm a graphic designer, so I'm at a desk most of the day. I try to take breaks and move around, but I guess I'm sitting more than I should. That's when the pain really gets to me, after a few hours in the chair.
Sitting for long periods can definitely contribute to back pain, especially if your posture isn't ideal. Desk jobs tend to put extra pressure on the lower back, especially if your workstation isn't set up to support good posture. We'll talk about some ergonomic changes you can make to reduce that strain.
Yeah, I've been meaning to look into that. My chair isn't the greatest, and I know I slouch a lot.
It's common, especially when you're focused on your work. But making a few adjustments to your chair, desk height, and how often you stand or stretch can make a big difference. We'll also work on some exercises to strengthen your core and back muscles to support better posture and reduce the strain on your lower back.
Exercises sound good. I'm just worried about making it worse. Should I still be working out right now?
That's a great question. We'll need to modify your workouts for now. Heavy lifting, especially exercises like deadlifts or squats that put pressure on your lower back, should be avoided until the pain improves. But that doesn't mean you need to stop exercising altogether. There are plenty of low-impact exercises that can actually help with back pain by improving flexibility and strengthening the muscles around your spine.
So more stretching and core work, less heavy lifting?
Exactly. Stretching, especially your hamstrings, hip flexors and lower back, can relieve some of the tightness and improve your range of motion. And focusing on core stability exercises, things like planks, bridges and bird dogs, can strengthen the muscles that support your spine, which is crucial for long-term relief.
Extract 2, questions 13 to 24. You hear a neurologist talking to a patient called James. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. James. I'm Dr. Collins. Pleased to meet you.
Hello, doctor. Thank you for seeing me today.
Of course. I understand you've been noticing some changes lately. Could you start by explaining what's been happening, in your own words?
Sure. It's been a gradual thing, really. I guess it started about a year ago. I noticed I was forgetting small things, like where I put my keys or why I walked into a room. At first, I thought it was just part of getting older, but it's gotten worse. Now, it's more than just the little things. Sometimes, I'll forget conversations I had earlier in the day, or I'll struggle to find the right words when I'm talking.
That must be frustrating. Have you noticed any other changes, perhaps in your daily routine, or how you go about tasks?
Yeah, that's what worries me. I've always been very independent, you know. But now, I'm finding it hard to follow through on things. Like, I'll start making dinner and forget what I'm doing halfway through. My wife, Susan, has had to step in more and more to help out. It's embarrassing, honestly. I feel like I'm losing control of my own mind.
I can understand how unsettling that must feel. Has anyone else, like Susan or close family, noticed these changes as well?
Yes, Susan has been worried. She says I repeat myself a lot, like asking the same question over and over. At first I didn't realize I was doing it, but now I notice when she gets that look, you know, like she's already answered me. She tries to be patient, but I can tell it's wearing on her. She's been the one pushing me to come see someone.
It's good that you came in. These kinds of changes can be difficult to deal with, both for you and your loved ones. What you're describing does suggest some early signs of cognitive decline, but we need to do a thorough evaluation to understand what's happening. There are many conditions that can cause memory problems, and dementia is just one possibility.
I've been reading a bit about dementia, and I'm scared. My father had Alzheimer's, and I remember how hard that was for him, and for all of us. I don't want to go through that.
I understand your concern, and I'm sorry to hear about your father. Dementia is a broad term that encompasses a number of different conditions, Alzheimer's being one of the most common. But it's important to know that not all memory issues necessarily lead to dementia, and even if it is dementia, there are many strategies and treatments we can use to help manage the symptoms.
So, how do we figure out if it's dementia? What kind of tests do I need to take?
We'll start with some cognitive assessments. These are structured tests that help us understand how your memory, attention, and problem-solving skills are functioning. We'll also do blood work to rule out other possible causes, like vitamin deficiencies or thyroid issues, both of which can affect memory. I'd also recommend an MRI of the brain to check for any structural changes that could be affecting your cognitive function.
And what if the tests show it's dementia? What then?
If it turns out to be dementia, the next step is determining which type. Alzheimer's is the most well-known, but there are other types, like vascular dementia, Lewy body dementia, or frontotemporal dementia. Each type progresses differently, and the treatment approach may vary. While there's no cure for dementia at this point, there are medications and therapies that can help slow down the progression and improve quality of life.
So, these treatments, what do they actually do? I mean, can they stop it from getting worse?
They can't stop the disease entirely, but they can help manage symptoms. For example, medications like cholinesterase inhibitors or memantine can help with memory and cognition in Alzheimer's patients. There are also behavioral therapies that can assist in managing some of the emotional and psychological effects of dementia, like anxiety, depression, or agitation. And it's not just about medication. Lifestyle changes, such as staying mentally and physically active, can also make a big difference in slowing progression.
I guess I was hoping there'd be some sort of cure, but I understand that's not the case. Not yet, at least.
It's completely normal to wish for that, and I do hope that in the future, we'll have more advanced treatments or even a cure. For now, though, it's about finding ways to manage the symptoms and maintaining as much independence and quality of life as possible. Support for you and Susan is also a key part of the process. Dementia affects the whole family, and there are resources out there to help.
Yeah, I can see how it would. Susan has already been taking on a lot more, and I hate feeling like a burden.
You're not a burden, Mr. James. This is a challenging condition, but you're taking the right steps by seeking help. We can work together to make sure you and your wife have the support you need. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear an intern talking to a doctor. Now read the question.
Yes, of course. Here we have a 40-year-old man with no significant past medical history presenting with repeated episodes of dizziness, confusion, and an unsteady gait. He reported consuming no alcohol during these episodes. His family noted that his breath often smelled of alcohol despite his claims. Lab tests confirmed elevated blood alcohol levels. The patient had consumed a carbohydrate-heavy meal prior to his most recent episode.
So, what is the specific diagnosis?
Based on the symptoms and lab findings, he has auto-brewery syndrome, where ingested carbohydrates are fermented into alcohol by gut microbiota, leading to unintentional alcohol intoxication.
Is this condition related to excessive alcohol consumption, and what is the treatment approach?
No, it's not due to alcohol consumption, but rather the internal fermentation of carbohydrates. The next step involves dietary modifications and antifungal medications to reduce gut fermentation.
Now look at question 26. You hear medical's professional taking to each other. Now read the question.
Brains mentioned experiencing weight gain and cold hands and feet. I didn't realize these were side effects of the beta blockers we prescribed.
Ah, yes. While weight gain and cold extremities aren't as common as side effects like fatigue or dizziness, they do occur in a small percentage of patients, about 1 in 10.
That's helpful to know. I was also surprised that increased sweating wasn't mentioned as a common side effect.
Actually, increased sweating is quite a rare side effect with this medication, affecting fewer than 1 in 100 patients.
Now look at question 27. You hear a pediatric dietitian talking to a parent about their child's weight. Now, read the question.
So, what brings you in today?
I'm really concerned about my son. He's been putting on weight, and I can't help but feel responsible. Maybe I'm not doing enough to control his diet or encourage healthy habits.
First of all, it's great that you're taking steps to seek professional guidance. It's important to recognize that childhood obesity is complex and not just about food choices or willpower.
I just feel like I could have done more to prevent this.
I understand why you feel that way, but it's important to understand that childhood obesity is influenced by various factors, including how the body processes energy, environmental triggers, and even genetic predispositions. Addressing it requires a mix of nutrition and lifestyle changes, but it's not simply a reflection of parental effort.
Now look at question 28. You hear a doctor talking about a patient. Now read the question.
So, Mr. Carter, let me explain the details of your treatment with steroids. You will be on this medication for an extended period to manage your chronic inflammation. However, it's important to understand the potential side effects. First, prolonged steroid use can lead to weight gain, which is common due to changes in how your body stores fat. Secondly, you may experience mood changes, such as irritability or even anxiety. Finally, there is an increased risk of infection because steroids suppress your immune system. Now, it is crucial that you do not stop taking this medication suddenly. Steroids must be tapered off slowly to avoid complications. And next.
Now look at question 29. You hear a surgeon talking to a patient. Now read the question.
Come in. Mr. Taylor, isn't it? My name's Dr. Evans, and I'm going to be discussing the head transplant procedure with you today. Please, have a seat.
I've been reading a lot about this, and to be honest, I'm really nervous about how this is even possible.
I understand your concern. Now, this is indeed a cutting-edge procedure, and it's still in the experimental phase. But what you should know is that we're making advancements, especially in reconnecting the spinal cord, which is the most challenging part. We're also working with new techniques to ensure immune compatibility between your head and the donor body.
That makes sense, but I'm still really anxious about it all.
I get that. We'll be using the latest technology and medical teams trained specifically for this. And remember, this procedure is still evolving, so we're taking every possible precaution. You'll have constant monitoring throughout, and we'll walk you through every stage.
Okay, that helps a bit.
Now, if you have any further concerns, feel free to press this call button anytime, and we'll get back to you.
All right, thank you.
Now look at question 30. You hear two colleagues talking to each other. Now read the question.
Year-old male who came in after a fall from a ladder. He's complaining of significant pain in his lower leg and an inability to bear weight. I took some x-rays and as you can see, there's a fracture here in the tibia.
Let's have a look. Yes, I can see the fracture line. It looks like a displaced fracture. Do you notice that slight gap between the bone fragments? That might indicate some degree of instability.
Yes, I noticed that too. The question now is whether we should go for surgical fixation or attempt conservative management with a cast. What do you think?
Given the displacement and the gap, I would lean towards surgical intervention. It's important to stabilize the bone properly, especially for weight-bearing recovery.
That is the end of part B. Now look at part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1. Questions 31 to 36. You hear an interview about the role of podiatrists in diabetic foot care management. You now have 90 seconds to read questions.
Today, we are joined by Dr. Reed, a podiatrist who specializes in diabetic foot care. Welcome to the program, Dr. Reed.
Thank you for having me. I'm excited to talk about the important role that podiatrists play in managing diabetic patients, especially when it comes to preventing severe complications.
You specialize in diabetic foot care. Can you explain why foot health is so critical for diabetic patients?
Absolutely. Diabetes often leads to complications like nerve damage and poor circulation, especially in the feet. This makes diabetic patients more vulnerable to developing ulcers, infections, and, in severe cases, amputations. Podiatrists play a crucial role in both preventing and managing these complications. We assess the risk level of each patient, provide education on proper foot care, and, if necessary, intervene with treatments such as wound care, orthotics, or surgical procedures.
It sounds like your role is vital in helping prevent serious outcomes. Has the role of podiatrists in diabetic care expanded in recent years?
Yes, definitely. Traditionally, podiatrists focused on more routine foot care, like trimming nails or treating minor infections. But now, as the prevalence of diabetes has increased, we are much more involved in multidisciplinary care teams. Podiatrists now work alongside endocrinologists, vascular surgeons, and diabetes educators. We play a key part in creating comprehensive care plans, especially for patients who are at high risk of complications. In many cases, we are involved in making decisions about surgical interventions, which would have previously been the responsibility of other medical professionals.
That's a significant change. What prompted this shift in responsibility?
A combination of factors, really. With the rise in diabetes cases globally, there was a clear need for healthcare systems to adapt. The idea is to utilize the specialized skills of allied health professionals, like podiatrists, to manage specific aspects of diabetic care. This shift has proven beneficial in several ways. It reduces the burden on general practitioners and specialists, increases job satisfaction for podiatrists, and most importantly, leads to better outcomes for patients. When podiatrists are more involved in the treatment process, there's a marked reduction in the number of amputations and hospital admissions due to diabetic foot complications.
Can you share an example of how your role might play out in a real-world case?
Sure. A few months ago, we had a patient who had been diabetic for over 20 years and was at very high risk for complications. He developed a severe foot ulcer, which was not healing properly due to poor circulation. I collaborated with a vascular surgeon to assess the need for a revascularization procedure, which would improve blood flow to the foot. In the meantime, I managed the wound care and fitted the patient with a custom orthotic to offload pressure from the ulcer site. It took months of careful monitoring and treatment, but we were able to heal the ulcer and prevent an amputation.
That's really impressive. I can see how important podiatrists are in these cases. Are there any frameworks or guidelines in place to support podiatrists as they take on these extended roles?
Yes, there are. Much like other healthcare professions, podiatrists have a framework to guide their practice, particularly when managing complex cases like diabetic foot care. One of the most recognized frameworks is the 5 essential steps in diabetic foot care, which all podiatrists follow. These include regular foot assessments, patient education, early identification of problems, appropriate interventions, and referral to specialists when necessary. Podiatrists are also encouraged to keep up with continuing education and evidence-based practices.
That sounds like a comprehensive approach. What do you see as the biggest challenge facing podiatrists in diabetic foot care today?
The biggest challenge is definitely the lack of consistent funding and resources. While our role in managing diabetic foot complications has expanded, many healthcare systems still do not allocate enough resources to foot care services. This can lead to delays in care and increase the risk of severe complications for diabetic patients. For example, in some areas, there aren't enough podiatrists to meet the demand, which means patients don't get seen as often as they should. Funding is also limited for things like specialized equipment and advanced wound care products, which are crucial in managing complex cases.
So, there's still a long way to go in terms of fully integrating podiatrists into diabetic care?
Yes, exactly. We've made a lot of progress, but there's definitely more work to be done. Podiatrists need to be recognized as an essential part of the diabetes care team. And healthcare systems need to invest in podiatric services if we want to continue reducing amputations and improving patient outcomes.
Thank you, Dr. Reed, for sharing your insights. It's clear that podiatrists play a critical role in diabetic care, and your work is making a real difference.
Extract 2. Questions 37 to 42. You hear Dr. Michael Thompson giving detailed presentation on Lassa fever. Now, read the questions. You now have 90 seconds to read questions.
Good morning, everyone. I'm Dr. Michael Thompson, and today I'll be discussing a topic that has gained considerable attention in recent years, Lassa fever. Lassa fever is an acute viral hemorrhagic illness caused by the Lassa virus, a member of the arenavirus family. It is endemic in West Africa, particularly in Nigeria, Sierra Leone, Liberia, and Guinea, where it infects tens of thousands of people each year. Despite its prevalence, Lassa fever remains underreported and often misdiagnosed due to its non-specific symptoms, which can mimic other diseases such as malaria, typhoid, and Ebola. The Lassa virus is primarily transmitted to humans through exposure to food or household items contaminated with the urine or feces of infected mastomys rats, a common rodent found in rural and urban areas of West Africa. Person-to-person transmission can also occur through direct contact with the bodily fluids of an infected individual, posing a significant risk to healthcare workers and caregivers. The challenge of controlling Lassa fever is compounded by the fact that about 80% of cases are mild or asymptomatic, making it difficult to identify and isolate infected individuals. However, in severe cases, Lassa fever can lead to multi-organ failure, severe bleeding, and even death. One of the biggest challenges in managing Lassa fever is the delay in diagnosis, because the symptoms of Lassa fever, such as fever, headache, and muscle pain, are common to many other illnesses. It is often not immediately suspected, especially in non-endemic regions. This raises critical questions. How can we improve the speed and accuracy of Lassa fever diagnosis? And what measures can be taken to prevent misdiagnosis in at-risk areas? Early detection is vital, as studies have shown that prompt treatment with antiviral drugs, particularly ribavirin, significantly improves survival rates when administered early in the course of the disease. Recent research highlights the importance of early intervention and effective treatment strategies. A study published in the New England Journal of Medicine examined over 1,000 patients diagnosed with Lassa fever and found that those who received ribavirin within the first 6 days of symptom onset had a significantly lower mortality rate compared to those who received the drug later. The study also underscored the need for supportive care, including fluid management, treatment of complications, and appropriate infection control measures to prevent the spread of the virus. However, the management of Lassa fever is not without its challenges. Ribavirin, while effective, is not universally available, and its use can be limited by cost, side effects, and the need for early administration. Additionally, supportive care in resource-limited settings can be inadequate due to a lack of medical supplies, trained personnel, and proper isolation facilities. These barriers underscore the urgent need for investment in healthcare infrastructure and the development of new, more accessible treatments for Lassa fever. Another critical issue is the impact of Lassa fever on healthcare workers. The risk of infection among medical staff is high, especially in settings where personal protective equipment, PPE, is either unavailable or improperly used. In many Lassa fever outbreaks, healthcare workers have been among the most affected, highlighting the need for rigorous infection control protocols and adequate training on the proper use of PPE. Addressing these challenges is essential not only for protecting healthcare personnel, but also for ensuring that hospitals remain functional during outbreaks. Beyond the physical health impact, Lassa fever also poses a significant psychological burden on patients, families, and healthcare workers. The fear of contracting a potentially fatal disease can lead to stigma, social isolation, and anxiety, which further complicates the management of outbreaks. It's not uncommon for communities to experience panic during Lassa fever outbreaks, which can disrupt daily life and deter individuals from seeking timely medical care due to fear of being ostracized. Efforts to prevent Lassa fever must focus on public health education, rodent control, and improving diagnostic and treatment facilities in endemic areas. Raising awareness about the importance of food safety, proper sanitation, and the risks associated with rodent exposure can help reduce the incidence of the disease. Furthermore, research into vaccines and new antiviral treatments is ongoing, with the hope of providing more effective prevention and treatment options in the future. In conclusion, Lassa fever is a complex, often overlooked disease that requires a comprehensive approach to management and prevention. Early diagnosis, timely treatment, and robust infection control measures are critical to reducing the impact of this illness. It is also essential to support healthcare workers and educate the public to prevent panic and stigma associated with the disease. By taking these steps, we can better protect vulnerable communities and improve outcomes for those affected by Lassa fever.
That is the end of Part C. You now have 2 minutes to check your answers.